Uh, Hello and welcome to this tutorial on the external carotid artery. So in this tutorial, we are going to see about the external carotid artery. Now, when you are studying about the external carotid artery, the first thing we should be seeing about is the common carotid artery. So let us first see about the common carotid artery. So it's a very basic thing to see. Uh, how is the external carotid artery coming from the common carotid artery? So this is the common carotid artery. So let's see about this. Now, so about the common carotid artery. So let's draw this artery. So you have this artery. Now, the artery that I have drawn, it's directly coming out from the heart, and the name of that artery is the arch of aorta. I'm very sorry for the background noises, but please bear with me. So this is the arch of aorta. So this is directly coming out from the heart. Now, this arch of aorta, it's giving some branches. So actually, there are three branches from this. So this is the first branch, this is the second branch, and this is the third branch. So what are these branches? So this is the first branch. So you can just name these branches as, so this is a B. So you can call it as B. This is the second letter, and this is S. So B, C, S branches are there. So B, C, S. B stands for brachiocephalic. So B stands for brachiocephalic. So B is an artery. The name of this artery is called the brachiocephalic trunk. C stands for, now this is on the left side. Okay, so this is on the left side. So this is the left common carotid. So this is the left common carotid artery. And this is also on the left side subclavian artery. So this is on the left side subclavian artery. Now the question that might arise is, so if there's a left side common carotid, obviously there should be a right side common carotid. So from where is the right side common carotid coming? So it's very simple actually. So the brachiocephalic trunk, which is present on the right, it is giving rise to two arteries, 1 and 2. So that's pretty much it. So this is the right side. Now this one is the right side subclavian artery. So this one is the right side subclavian artery. This is the right side subclavian, and this is the right side common carotid. So this is the right side common carotid artery. So the first question will be answered, that the common carotid on the right side. So you can clearly see the common carotid on the right side. It's coming out from the brachiocephalic trunk, and the common carotid on the left side, it is coming out directly from the arch of aorta. So that's a very basic concept that I'm teaching right here. Now, once you have understood the basics of the common carotid, so now from here we can further go to the concept of external carotid. So at a point, so you have this artery. So you have this artery. Now this is the artery that I'm trying to draw here. So this is the artery, yes. Okay. So this is the artery that I've, sorry for my bad drawing. So this is the artery that I've drawn. Now this artery is actually the common carotid artery. So this is the artery that I've drawn. This is the common carotid artery. Now on the right, on the left, I'm not concerned about that, but this is the common carotid artery. So this is the common carotid artery. Now this common carotid artery, it divides into two branches. It will divide into an external carotid and an internal carotid artery. So the external carotid, it's outward. It's pretty much outward. So this is the external carotid artery. So this is an external carotid artery. Or I should not write here. Let's write somewhere different. So this is the artery that I've drawn. This is the external carotid artery. This is the external carotid artery. External carotid artery. And this artery is the internal carotid artery. Now the question you might ask is, where is this artery coming from? You know, this bifurcation, which you can see, this bifurcation is taking place at which point? Now, now this is the region, this is the neck region actually. Whatever I'm discussing right now, this region is the neck region. Now at the region of the neck, so you have a certain cartilage right here. So you have a cartilage right here, and the name of this cartilage is the thyroid cartilage. So this is the thyroid cartilage. So this is the thyroid cartilage. So at the upper border of thyroid cartilage. So let me show you. So you can see clearly at the upper border of thyroid cartilage. So at the upper border of thyroid cartilage, so it's not clearly at the upper border. So let me just modify this thing. Okay, yes. So I have modified this. So this is the thyroid cartilage. So I'm seeing from the side view. So at the level of the thyroid cartilage, it is dividing into two parts. The bifurcation that is taking place into the external carotid and the internal carotid, this is taking place at the upper border of the thyroid cartilage. So this is taking place at the upper border of the thyroid cartilage. So it's pretty simple that way. Yes. Now you might ask, what's the vertebral level? So it's mostly at the vertebral level of C4. It's mostly at the vertebral level of C4. Some people say it as C3 to C4. So at this level of C3 to C4, at the upper border of thyroid cartilage, or you can call it at the level of C3 to C4, the common carotid, it is bifurcating into external carotid and internal carotid. Now, this artery which you are seeing right here, this artery is now at the region of the neck, right? Now, the fascinating thing about the internal carotid is that it has no branches in the neck. So there are absolutely no branches in the neck. So there will be some another tutorial on this. So it has no branches in the neck. So no branches in neck. So it is good. It's a good thing that there are no branches in the neck. So whatever branching we will discuss, it will be about the external carotid artery. Now, before discussing about the branches of the external carotid artery, I should discuss about two very important structures. So let me show you these structures. Okay, so here's a very clear diagram about what is happening actually. So you can see right here. So as you can see, so this is the arch of aorta. So what you are seeing right here, this is the arch of aorta. So this is the arch of aorta. Yes. So this is the arch of aorta. Now from the arch of aorta, three branches are coming out. So I told you these are B, C, S branches. So these are the BCS branches. So B for brachiocephalic. So this is the brachiocephalic, and this is the left side common carotid, and this is the left side subclavian. Now this brachiocephalic is further dividing into this is the subclavian and this is the common carotid on the right. So this is the right side common carotid and this is the right side subclavian. So that's the basic concept right here. So here's another view of the common carotid. You can pretty much clearly see right here. So this is the arch of aorta. So this is the this is the aorta, or this is the arch of aorta. So arch of aorta, and from that you have the brachiocephalic, and behind that, so this is the common carotid, and the artery which is right behind is the subclavian, right? So this brachiocephalic, it is dividing into the common carotid on the common carotid artery on the right side, and the artery which is going behind. So this is the left side common carotid. So this is the left side. Sorry, this is the right side subclavian. So sorry. This is the right side subclavian, yes. This is the right side subclavian artery. So here's another view of the common carotid artery. You can clearly see right here. So you can see right here. So if you see this image properly, so you can see this artery. Now this artery is what I'm talking about. This is the common carotid artery. So this artery which you can see right here. So this is the common carotid artery, and you can see there's a bifurcation that is taking place right here. Now this point is the point where you have the thyroid cartilage. So this is the point where you have the thyroid cartilage. So this is the point right here where you have the thyroid cartilage, or I should properly say as the upper border of the thyroid cartilage. So you can see right here. So you have the upper border of the thyroid cartilage. So this is another side view of the artery. Now this is the common carotid artery. This is the common carotid artery. So this artery which I have drawn. Now right here you can see a body. This this thing is called, so you can see right here, this is called the carotid body, and this is at the bifurcation, and you can see right here there's a sinus, and that sinus is called the carotid sinus. So this is the sinus which is called the carotid sinus. Now the carotid sinus which is there, now this carotid sinus, it is at the starting point of the internal carotid artery, and this carotid body which you are seeing, this is at the bifurcation of the carotids. So this is at the bifurcation of the carotids, of the common carotid artery. So let's talk about these now. So talking about this carotid body and carotid sinus, so we can talk about this. So let's just take this image. So I'm taking this image, I'm copying this, and voila. Yes, so let's talk about this now. Now, so I had said that this is the common carotid. I'm using some smaller terms. So this is the common carotid artery. This artery which I have shown, which is going outward, this is the external carotid artery, and this artery which I have shown right here, this is the internal carotid artery. Or yes, so this is the internal carotid artery. Yes, so this artery right here is the internal carotid artery. Now, talking about these arteries, we can pretty much clearly see. Um, let's see now. So we are going to see two bodies. Number one, so here's a structure which you can see. So this is a structure. Now, so here's a structure. So this is number one, and this is number two. This is number one, and this is number two. So let me write it down. So this is number one, and this is number two. So what is number one and what is number two? So let's talk about number one. Number one, which I have drawn, it is the carotid body. So this carotid body, you can just write down as CB. Carotid body as CB, right? So what is the meaning? So how can you remember? How can you remember? So this is the carotid body, that's number one, and that's the number two is the carotid sinus. So number one is the carotid body, and number two is the carotid sinus. So how can you remember these things? You can pretty much, so you can see this has the letter B, right? So B means it is present at the bifurcation. Yes. So it is present at the bifurcation. So it is present at the bifurcation of common carotid artery. So obviously you can say that this carotid sinus, it is at the starting point of internal carotid artery. So it is at the starting point of internal carotid artery. So the common carotid artery, so that's about the carotid body. The other thing that we should note is that the carotid body, it's a yellow pigmented structure. So carotid body, it's a yellow pigmented body. That's why I'm writing down in yellow. It's a yellow pigmented body. While on the other hand, the carotid sinus, it's a fusiform dilatation. It's a fusiform dilatation of the internal carotid artery. So it's a fusiform dilatation of the internal carotid artery. Now, both these structures have very clear roles on what they do. So this is a very physiological concept, and the physiological concept is, see, whenever you are making up the memory devices, you should always see the carotid body. So the carotid body, so B is for baroreceptor, so the B is for bifurcation, and the C is for chemoreceptor. So carotid body is a chemoreceptor. The carotid body, it's a chemoreceptor. However, on the other hand, the carotid sinus, it's a baroreceptor. So the carotid sinus, it's a baroreceptor. Now, the other thing that you might wonder is, what is a nerve supply? Let's talk about the nerve supply. So let us talk about the nerve supply. So you have a nerve. So this nerve is coming. So the carotid body, let's talk about the nerve supply of the carotid body. So there's a nerve, and this nerve is coming and supplying the carotid body, and so this nerve is called the nerve to carotid body. This is called the nerve to carotid body. So this is called the nerve to carotid body. Now the nerve to carotid body is coming from a nerve. The name of that nerve is vagus. So vagus is the 10th cranial nerve. So I'll make some tutorials on these nerves also. So vagus is the 10th cranial nerve. It is the 10th cranial nerve, and the vagus is having a pharyngeal branch. So what are these things? I'll discuss in some other tutorials. So the vagus is having a pharyngeal branch. So it is having a pharyngeal branch, and the pharyngeal branch is giving rise to the nerve to carotid body. So the nerve to carotid body is supplying the vagus. So the vagus, the pharyngeal branch of vagus, it is forming the nerve to carotid body, and it is supplying the carotid body. However, on the other hand, there's also another nerve. This nerve, it is innervating the carotid sinus. It is innervating the carotid sinus, and the beautiful thing about this nerve is it is also innervating the carotid body. So it is innervating both carotid sinus and the carotid body. So the name of this nerve is carotid sinus nerve. So the name of this nerve is carotid sinus nerve. It is aptly named as carotid sinus nerve. And the carotid sinus nerve, it is coming from the glossopharyngeal. It is coming from the glossopharyngeal nerve. It is coming out from the glossopharyngeal nerve. So it's coming out from the glossopharyngeal nerve. So glossopharyngeal is the 9th cranial nerve. So it is the 9th cranial nerve. Now let's just write down the nerve supplies. So what is the nerve supply of the carotid body? What is the nerve supply of the carotid body? The carotid body is supplied by the 10th cranial nerve. Yes. The carotid body is supplied by the 10th cranial nerve. So the nerve to carotid body, which is coming from the pharyngeal branch of the vagus nerve. So it's giving rise to the nerve to carotid body, and it is supplying the carotid body. Also another important point is the 9th cranial nerve is also supplying the carotid body. The 9th cranial nerve is also supplying the carotid body. So the 9th cranial nerve, it's also supplying the carotid body. However, on the other hand, the carotid sinus, it is supplied by only the 9th cranial nerve. It is supplied by only the 9th cranial nerve. Now, but it is seen that sometimes the 10th cranial nerve or the nerve to carotid body also supplies the carotid sinus. So sometimes it's seen that way. So mainly the nerve supply of these two are, I can just write down. So these two nerves are mainly the nerve supply. This nerve is the main nerve supply of carotid sinus, and the 10th nerve does supply carotid sinus sometimes also. So that's pretty much it. Now, we have talked about the carotid body, we have talked about the carotid sinus. Now we will dive onto the external carotid artery branches. Let's talk about the branches of external carotid artery. So let us talk about the branches. So branches of external carotid artery. Let us talk about the branches of external carotid artery. Now, so there are a lot of branches. There are actually a lot of branches. So in order to remember all these branches, there is a memory device or a mnemonic, and that mnemonic is, so please remember the mnemonic, because when you remember the mnemonic, it's easy to remember. So this is not in the proper arrangement, but it helps you remember what are the anterior branches, what are the posterior branches, what are the medial branches, and things like that. So there are anterior branches and there are posterior branches. So anterior branches means the branches that are coming out from the anterior side. There are branches that are coming out from the posterior side. There are branches that are coming out from the medial side, and there are also branches which are the terminal branches. There are also branches which are the terminal branches. There are 3 anterior branches. Reduce the number right here. So there are 2 anterior posterior branches. There is only 1 medial branches, and increase the number by 1. So it's a 2 terminal branches. So what I did right here is 3. It's a -1 right here. So you can subtract 1 right here again and add 1 right here. So that's what I've done right here. The mnemonic is, it's very simple. So mnemonic is something like this. So sister. So you have a sister. Sister loses the phase. Sister loses phase of powder. Sister loses phase of powder. Now, whenever the sister loses the phase of powder, it attracts medical students. It attracts medical students. It attracts medical students. So these are the different branches. So let me write down the branches. So sister means superior thyroidal. So this is the superior thyroidal. So superior thyroid artery. So sister. L for lingual artery. Lingual artery. F for facial artery. Facial artery. So these three branches are the anterior branches. Other than that, what are the posterior branches? Sorry. So what are the posterior branches? So O for occipital. O for occipital. So occipital artery. You also have the posterior auricular. You also have the posterior auricular. Whenever you see the word auricular, that means it's supplying the ear. So posterior auricular. Then you have the tract, which is called the ascending pharyngeal. Ascending pharyngeal. Ascending pharyngeal. And finally you have, this is the medial branch. So there's only one medial branch, that's the ascending pharyngeal. And you also have a medial, that means there are two terminal branches. Number one, it's a maxillary artery. And also S for superficial temporal. And also S for superficial temporal. So I don't have space right here, so let me make up some space. So it's superficial temporal artery. So maxillary artery and superficial temporal artery are the terminal branches. The anterior branches are, so there are three anterior branches: superior thyroidal, lingual artery, facial artery, posterior occipital artery, posterior auricular. Medial branches only one, ascending pharyngeal. And you also have terminal branches, that's a maxillary and superficial temporal artery. Now we will discuss about all these branches. So let's discuss about all these branches. So this is a representative artery that I'm drawing right here. So this is the external carotid artery. So this artery which I've drawn right here is the external carotid artery. So this artery is the external carotid artery. This is the external carotid artery. Now let us see what are the different branches that's coming out from the external carotid artery. The first branch that's coming out from the external carotid artery is right here. So this is an artery that's coming out, and this artery is going to supply the superior pole of the thyroid gland. So this artery is supplying the superior pole of the thyroid gland. So there is a representative thyroid gland, and this artery is supplying the superior pole of the thyroid gland. The name of this artery is superior thyroidal artery. So this artery which you can see, so the name of this artery is superior thyroidal artery. So please notice that this is the first branch that I have drawn. So this is the superior thyroidal artery and this is the first branch, right? So superior thyroidal artery. So some questions that are, so what is the first branch of external carotid artery? And that's the superior thyroidal artery. Now the superior thyroidal artery, it has also some other branches. It's also giving some sub branches. What are those sub branches? You can just remember it by a simple word play, SSICG. Just remember these letters. Sorry for that noise. Just remember these letters, SSICG. So what are these SSICG stands for? So just remember SSICG. So S for, it is supplying the, it is an artery. It's a very important artery that I'll talk in some other tutorial. It's a superior laryngeal artery. So it's a superior laryngeal artery. And then there's a sternocleidomastoid. So there's a muscle. That muscle is called sternocleidomastoid. It's a very important muscle in the neck. Sometimes it might not work. So the sternocleidomastoid is also supplied by a branch of superior thyroidal artery. Then there are muscles in front of this artery which is called the infrahyoid muscles, and all these infrahyoid muscles are supplied by these infrahyoid branches. There is a muscle of the larynx which is called the cricothyroid. So the cricothyroid muscle is also supplied by the superior thyroidal artery. And finally, these are the glandular branches which are supplying the superior pole of the thyroid gland. So this is the thyroid gland. So this, what I have drawn right here, is the thyroid gland, and the thyroid gland is supplied by the glandular branch of. So these are the different branches. So sternocleidomastoid branch, infrahyoid branch, cricothyroid branch, glandular branches. So all these are the different branches of arteries. These are the branches of superior thyroidal artery. So that's the first branch. Now the second branch that we should talk about. Let's talk about the second branch. Coming to the second branch. So the second branch that we should talk about, that's going medially. So it's a medial branch. So you can clearly see the branch that's going medially. So I have drawn it medially. What's the branch? Can you name the branch? So it's called the ascending pharyngeal artery. So it's between the internal carotid and the pharynx. So that's why it's called the ascending pharyngeal artery. So this is the ascending pharyngeal artery. So it's an ascending pharyngeal artery. Now this ascending pharyngeal artery, it has many branches. You can just remember by some word. It's not a very good word. So just remember it by the word PIMP, pimp. So pimp is, you can Google it up. What's pimp? Just remember pimp, PIMP, PIMP. So PIMP, pimp. So it's not a very good word, but it's a good memory device. Pimp are the branches of ascending pharyngeal. So let me write down in some different color. So P for palatine. So palatine branches. P for palatine. I for I stands for inferior tympanic. So whenever you're talking about the tympanic, that means we are talking about the ear. So inferior tympanic. M for it's a meningeal branch. It's given to the meninges, the meningeal branch, and P for pharyngeal branch. So P for pharyngeal branch. So these are the different branches of ascending pharyngeal. You can remember this by the word pimp, PIMP, pimp. Now let us talk about So let us talk about the third branch. So the third branch, which you can see, so this is the third branch. So yes, so this is the third branch. Now the third branch, it is coming at the level of a bone. Now the name of this bone which you see right here, the name of this bone is called the hyoid bone. This is called the hyoid bone. Now from the hyoid, there's a muscle right here. The name of this muscle is hyoglossus, and there's a muscle which is right here. The name of this muscle is middle constrictor. So there's a muscle right here. The name of this muscle is middle constrictor. Middle constrictor. So this is a middle constrictor muscle, and this is now, and from the hyoid bone, there's this muscle which is coming out, which is called the hyoglossus. So hyoglossus muscle. You can see this muscle which is called the hyoglossus muscle. So this is the hyoid bone and the hyoglossus and the middle constrictor. Now you can clearly see an artery which is going between the hyoglossus and the middle constrictor. So an artery which is going between the hyoglossus and the middle constrictor, and the name of this artery is called the lingual artery. So this artery which you see right here, so this is the lingual artery. So this artery right here is the lingual artery. So this artery is the lingual artery. So this lingual artery obviously have some subdivisions. It obviously have some branches. So what are these branches? These branches are, you can just remember. So very simple. You can remember by, so DS. DS is someone's name and another DS. So DS. So they are very simple actually. DS. What are these DS? It's nothing. So you can just remember simply. D stands for dorsal lingual. About these arteries also we will discuss in different tutorials. Dorsal lingual. So this is a sublingual, dorsal lingual, sublingual, deep lingual, and finally submandibular. So dorsal lingual, sublingual, deep lingual, and submandibular. So these are the different arteries that I'm talking about. So these are the different branches. So dorsal lingual branch, sublingual branch, deep lingual branch, and submandibular branch. So these are the arteries which are actually branches of the lingual artery. So that's about the lingual artery. Now, just above the lingual artery, you have another artery. So this is the last and the final anterior branch, and this artery is called the facial artery. So, facial artery is it's a very important artery which is present in the face, actually the anterior part of the face. So it's going behind the mandible, and then it is having many branches. It's having some glandular branch, it's having some tonsillar branch, it's having an inferior labial, superior labial, lateral nasal, many branches it has. So I'll be discussing about the facial artery in some other tutorial. Meanwhile, just remember that this is an anterior branch of the external carotid artery. Now, the next artery that I should be talking about is a posterior artery. Now, the posterior artery is just now this posterior artery which is there, so it is coming out from the external carotid artery just at the level of facial artery. So there's an artery which is coming out just at the level of facial artery. So there's the artery that I've drawn, and this artery is coming out just at the level of facial artery, and this artery is called the occipital artery. So this artery which you can see right here, this is called the occipital artery. So the artery right here which I have drawn is the occipital artery. Now this occipital artery is dividing into two branches. So this occipital artery is dividing into two branches. So number 1 and number 2. There are two branches of the occipital artery. So let me talk about the occipital artery. So occipital artery has two branches. Now one branch is supplying a muscle. So occipital artery, so this branch which you can see right here, it is supplying a muscle. So it is supplying a muscle. So this is a representative piece of a muscle. So this muscle is called the sternocleidomastoid and the sternocleidomastoid branch. So obviously, so this is a sternocleidomastoid. So one branch, so the occipital artery has two branches. One of the branches is supplying the sternocleidomastoid, and the other branch which you can see is called the it is called the descending branch. It's going down, right? So you can clearly see it's going down. Whenever it's going down, that means it's called the descending branch. It is called the descending branch. Now this descending branch is further dividing into two branches, one superficial, one deep. So this is the superficial branch. So this is the superficial branch, and this is the deep branch. So this is the superficial branch and this is the deep branch. So the deep branch, it is anastomosing. It is anastomizing. So this deep branch, it is anastomizing with D for deep cervical artery. So it is anastomizing with the deep cervical artery. So the deep cervical artery is actually a branch of, so I'll talk about the deep cervical artery. So the deep cervical artery is actually a branch of costocervical trunk, and I'll discuss about this artery in some other tutorial. So meanwhile, just remember the deep branch of the descending branch of the occipital artery, it is anastomizing with the deep cervical artery, and the superficial branch is anastomizing with the superficial branch of, it is anastomizing with the superficial branch of transverse cervical artery. It is anastomizing with the superficial branch of transverse cervical artery. So it is anastomizing with the superficial branch of transverse cervical artery, and that's called the occipital artery. So that's pretty much everything about the occipital artery. And these arteries which I just said, deep cervical and transverse cervical, I'll discuss about them in a different tutorial. Now the other posterior branch that we should be knowing about is the posterior auricular. So this is a very thin branch. Okay, one more thing that I should talk about. Can you see the ascending pharyngeal artery? I have made it very short. It's a very short branch. It's not having much distance, right? So that's why. So it's a strategically made artery. This is the shortest branch, and this is the second branch. So this is the second branch, and this is the shortest branch. So that's a very important observation from that artery. So the last artery that I should talk about is this artery. The name of this artery is posterior auricular. So you can see right here, this is the posterior auricular artery. Posterior auricular artery. Now this posterior auricular artery, it has some branches. What are these branches? Just remember the mnemonic. You can just remember SAO, SAO. Just remember SAO. So SAO stands for stylomastoid branch. So it is having a stylomastoid branch. It's also having a auricular branch. Auricular means ear. It's always ear. And it's also having an occipital branch. So this is not the occipital artery, it's a branch. It's just an occipital branch that's going to the occipital bone. That's related to the occipital bone. So stylomastoid branch, auricular branch, and the occipital branch. So these are the branches of posterior auricular artery. Finally, after this, there are some terminal branches. So we are going to finish right now. So there are some terminal branches. What are these terminal branches? One branch that is going up, and it's dividing further into an anterior branch and a posterior branch. And this artery is called the superficial temporal artery. And there's an outer artery which is a very important artery that is going through the infratemporal fossa. Then it's going to the pterygopalatine fossa, and it has many branches. It has many branches. It has a first part, it has a second part, and it's a third part, and every part has branches. The first part has, I think so. The first part had 4 or 5 branches. We'll talk about all those branches in a different video. We will talk about the maxillary artery in a different video. So meanwhile, just remember. So this, I'm very sorry. So this is the maxillary artery. This is the maxillary artery. So this is the maxillary artery, and this is the superficial temporal artery. So this is the superficial temporal artery. So this is the maxillary artery and the superficial temporal artery, which is dividing into an anterior branch and a posterior branch. So this is an anterior and a posterior branch. So this is all about. So this is pretty much everything about the arteries that I've talked. So this is all about the arteries of the external carotid artery. So this is all about the external carotid artery. So you can see I have talked quite in detail about the external carotid artery. So these are all everything about the external carotid artery. Now finally, let me show you an image. So here you can see the first branch of the external carotid artery, and that first branch is the superior thyroidal artery. So you can see right here the first branch, and that's the superior thyroidal artery. So this is the superior thyroidal artery. You can see the superior thyroidal artery, it's going to the superior pole of the thyroid gland. So it's going to the superior pole of the thyroid gland. So that's the first part. Other than that, you can also see this branch. So this is another anterior branch which you can see right here. This is the lingual artery. So this is the lingual artery. This is the lingual artery, and you can see so this is the second branch, and this is the third branch. You can see pretty much this is the third branch, and the name of this third branch, which is an anterior branch, and that's a facial artery. So that's a facial artery. So these are the different branches which you can see right here. Okay, so here you can see much more better the superior thyroidal artery. So this is the first branch. So that's the superior thyroidal artery. So this is the superior thyroidal artery. Now the other important thing about the superior thyroidal artery is, you can see these muscles, right? So all these muscles are infrahyoid muscles. So I'll discuss about them in another tutorial. So these are infrahyoid muscles. The superior thyroidal artery will supply branches to these infrahyoid muscles, and that's why I said SSICG. SSICG, that means number 1, it's a superior laryngeal. It is supplying the sternocleidomastoid. It's supplying the infrahyoid muscle. It is supplying the cricothyroid. It is also supplying the glandular branches. All these are the different branches. Okay, and finally you can see this illustration where you can see the arteries. So this is the common carotid artery, and you can see here you have the carotid body, and here you have the carotid sinus. So this artery right here is the internal carotid artery, and this artery right here is the external carotid artery. So let me not write like that. So this artery right here is the external carotid artery, or I can write this way. Yeah, this is the external carotid artery. So this is the external carotid artery. So what are its branches? You can see some anterior branches, right? So this is an anterior branch. So this is the superior thyroidal artery. So superior thyroidal artery. So what are the branches of superior thyroidal artery? I have told you it's a SSICG. That means number 1, it's a sternocleidomastoid. It is also supplying the superior laryngeal artery is infrahyoid, it's cricothyroid, glandular. All these are branches of superior thyroidal. Other than that, I said about this artery. So this is another anterior branch which is coming after this. So this is a lingual artery. And I told you about the lingual artery branches. So the lingual artery branches can be just remembered by DSDS. DSDS stands for deep lingual, sublingual, dorsal lingual, submandibular. So all are the branches. So these are lingual. Now I'll talk about, so this is another artery, that's an anterior branch, and that's the facial artery. You can see right here, this is the facial artery. Facial artery has many branches that I'll talk about in another tutorial. Now let us see the terminal branches. So this is a maxillary artery. So this is the maxillary artery, and this is also a very important artery, maxillary artery. And then you can see this artery right here. So this is the superficial temporal artery. So this is a superficial temporal artery. This is about the superficial temporal artery having an anterior branch and a posterior branch. Then you can see some more arteries. So yes, you can see this artery right here. So this is a posterior. So this artery which you can see right here. So there's a a posterior branch. So yes, so one of the arteries right here, you can see this is a posterior branch, and this is the occipital artery. So this is an occipital artery. So the occipital artery has also some branches. So what are those branches? So occipital artery, it has a branch that is supplying a muscle. The name of that muscle is sternocleidomastoid. And it is also having a descending branch. So it is having a descending branch, and the descending branch is supplying. It is having a deep branch and a superficial branch. So I told you about the deep branch. So the deep branch, it is anastomizing with the deep or deep cervical artery, and the superficial branch is anastomizing with the superficial branch of transverse cervical artery. Other than that, this is also a branch that I want to show you right here. So this is the branch that I'm talking about. Okay, sorry. So yes, so I'm talking about this branch right here. So this is another branch. What is this branch? So the name of this branch is it's called the posterior auricular. So this is the posterior auricular. So this is another posterior branch, posterior auricular. So it is having SAO branches. So SFO means stylomastoid, auricular, and occipital branches. And finally, this is the other final artery. This is called the ascending pharyngeal. So ascending pharyngeal, it has PIMP branches. PIMP, PIMP. That means palatine inferior tympanic meningeal pharyngeal. So that's everything about the external carotid artery. I have talked to you everything about the external carotid artery. Nothing more can be asked from this. So the tutorial on external carotid artery ends right here. So thank you for watching this video. I think your concepts will be cleared by now. And so that's it. And please like, comment, share, subscribe with your friends, with your doctor friends. And if anyone belongs to the medical profession, please share this video with them. Thank you.